You were one of the co-signatories of a letter published in The Lancet, essentially accusing the British government, very strong words, of conducting a dangerous and unethical experiment on the British people. What did you mean by that?
Well, in the UK at the moment, we are seeing soaring increases in coronavirus cases. In fact, the highest now for about 5 months, higher than many of the previous couple of peaks we've had. And what the government is proposing in the UK is that on July the 19th to remove all restrictions. So that would mean no more mandatory wearing of masks, no requirements for social distancing, has really said that we should be able to live life like before COVID. It says that any measures should be a matter of personal responsibility, but there would be no mandatory requirements for infection control measures. Now, we think this is not right because we know that coronavirus continues to be a deadly virus that is spread between person to person in close contact. As I said, the infection rates are soaring in the UK, and we also are seeing now increases in hospitalization and also increases in deaths. I should add that the levels of hospitalization are much lower than in previous waves because we have vaccinated about half of our population. But having said that, there are people becoming seriously ill. The other problem we also have is that about 1 in 10 people are suffering with long COVID, symptoms that are lasting more than 3 months, and about 2 million people have suffered with long COVID symptoms. So what we're saying is that I believe we're the only nation. Yeah.
I'm sorry to jump in. I just wanted to get your take on this because you mentioned yourself that the number of deaths is actually relatively low. It's not that number rising in the same proportion as the number of cases. And I guess those who support reopening would say, look, at what point do we go back to semi-normal when the number of deaths still kind of hover around 25, 30, 35 on a daily basis, that we need to get the economy going, we need to get tourism moving again? What would you say to those people who say to you, I appreciate the science behind your desire to be careful, but this country just can't keep being paralyzed? What would you say to them?
Sure. Well, first of all, we're not paralyzed. We have actually the weakest levels of restrictions at the moment. And so if you were here in London, you'd see a lot of people outdoors. They're able to eat in restaurants. They're able to travel. They're able to go to stay in hotels, etc. What we are saying, however, is that it doesn't make sense to remove all restrictions. It doesn't make sense, for example, to have an infection that is increasing exponentially. We had about 1,000 new cases when we ended the last lockdown a couple of months ago. We now have over 30,000. So what we're saying is there should be some targeted measures, such as if you're in a crowded underground train, it doesn't make sense for everyone to be infecting each other. I also would say it's not all about deaths. The hospitalization rate has increased twofold in the last month. So it might not be as high as before, but we have got about 400 people in the UK fighting on a ventilator, fighting for their lives. And we had about less than half that number a month ago. So it is increasing. The other issue to say is that just because you're not in hospital doesn't mean you're not ill. And we have, as I said, about 1 in 10 people suffering long-term effects of COVID. And that's not good for the economy. If people are off work, off sick, and they may not be in hospital, but as a doctor, I know that a lot of people who are ill are not in hospital. You can't just brush them out of the equation. They do also need to be protected and looked after.
Why do you think politicians then are ignoring scientific advice? You're not the only scientist or the only doctor to say this is reckless. Why do you think they're just choosing not to listen to you?
So I don't know, because actually what we are saying and what the science would say is that this is not an indefinite problem we're facing in terms of restrictions, because we know the vaccination program is effective. What we would like to see is enough of the population vaccinated to create that herd immunity where the infection rate will go down. At the moment, the spread of infection is occurring in the younger adults and in older children. They're the ones who are not yet vaccinated.
So you'd like to see 80%? You'd like to see 80% vaccinated?
Yes,
Would that be a good number?
And yes, and at the moment we have just vaccinated just over 50%. So it's certainly possible to achieve that. And when that is achieved, we will then hopefully see the control of this infection. We'll see the R number go down, and we'll be able to, I hope then, resume some normality in life without the danger of people becoming seriously ill or becoming ill with long-term symptoms. So it's
Yeah,
more a stage of choosing the right time rather than
sure.
saying you will never open. Of course, we need to be allowing the vaccination program to work. There's no point doing the vaccination program if we're never going to make any
I
changes as a result. But it's the
I have
right
so many
time. Now
questions.
is the wrong time.
I
Yeah.
have so many questions. I'm sorry to jump in, but one last one. We've heard, for instance, today that in Israel, a fully vaccinated 46-year-old died of COVID. We've also heard that here in the UK, fully vaccinated patients in hospital have also lost their lives to COVID. Should we be concerned that these vaccines are just not as effective as we thought they would be against the Delta variant?
No, I don't think we should be concerned because actually no vaccination for any illness is 100%. In fact, what we do know is that you need to have both vaccines to be fully protected, and you
Yeah.
need about 2 weeks after the second dose to be fully protected. So some people may catch the infection, a few days after the second dose. They wouldn't have been fully immunized, or the immunity would not be complete. So what we are saying is that all vaccines have a small failure rate. The vaccinations against the current strains is very effective, and that is why we should be confident in progressing with the sort of 80% level of coverage of the population with vaccinations. So yes, you will always, with every vaccination, get anecdotes, but actually we'll be doing a lot of good in terms of protecting the population if we can get to high numbers protected by the vaccination.
Got it. Dr. Chand Nagpal, thank you so much for joining us. It's always great having you on the program.